Hi, everyone. I just want to let you know that we'll be starting very shortly. We're going to give a little bit more time for people to join us. We'll be back in a moment. Thank you. afternoon, everyone. My name is Lisa Yurst, a physical therapist and regional director at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as those who are joining us for the first time. Thank you all for choosing to spend the next hour or so with us. We know that there are many bigger things going on right now, and we appreciate you taking the time out to learn with us today. For those of you who don't know who we are, Spear is a private outpatient practice that has been around for over 20 years, and we have currently 20 locations around the NYC metro area. Since the pandemic started, in addition to continuing to offer in-person care, we also launched Spear Live, which gives you the opportunity to receive physical and occupational therapy from the comfort of your own home in a virtual way. It's worth noting that most health insurances have access to waive patients' copays, co-insurances, and deductibles for telehealth visits. So if you've been putting off treatment, now's the time to reach out to us and get you back on track. Within the clinic, we are also going above and beyond the CDC guidelines and taking strategic measures to ensure everyone's safety and that our environment is clean. Please see our website at spearcenter.com for more details in regards to that. Since the COVID-19 pandemic started and our usual places of exercise had to close, a lot of people turned to running to get their workout in. As a result, we've seen a large influx of patients reaching out to us with complaints of pain during running, as well as general questions on running form and advice. Our team of clinicians got together and agreed that given this increase in activity, it would be a good idea to provide you all with some tips on running and how to both prevent and address some of the symptoms you may be experiencing. We created today's talk for you and are coming to you live from our own homes. We do not anticipate any technical issues today, but please be patient with us as we navigate working through some of this new technology. As part of our session, we will be demonstrating some exercises, and we really look forward to you following along and participating. I promise you this will not be like your typical Zoom meetings. We're gonna have some fun today. But please note that if you are experiencing any pain while we perform any of the exercises we demonstrate, please stop and reach out to us directly so that we can support you. So I wanna go through some housekeeping. Throughout the webinar, we wanna hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. I wanna take a moment to show you where that is. So if you can all hover at the bottom of your screen, you'll see the option to choose Q&A. That is where we want you to put your questions. We will do our best to address as many as we can throughout, and we'll have a Q&A section at the end as well. For those of you who are watching through YouTube Live, we are monitoring comment section there, so please feel free to type in your questions as well. Okay, so let's talk about what we're gonna do today, what our goals are. So first, we're gonna discuss common injuries for runners throughout the lower extremity and walk you through some ways to address your symptoms. We're then going to shift gears and review proper running form and biomechanics, while also considering ways to prevent those injuries. Ultimately, we want to get you moving. We will be demonstrating exercises throughout the webinar, and that will help you treat and diminish some of your pain. Okay, so before we get started, I'd like to introduce you to our team of panelists. We're going to welcome everyone on the screen now. All right, so here we have Christina Martello, who's a physical therapist at our West 67th Street location. Hi, Christina. We also have Andy Pachter, who's a physical therapist from our 95 Chambers office in Tribeca. And we have Joe Lacerda, who's a physical therapist and clinical director at our East 84th Street office. And he's going to be helping us behind the scenes with answering questions in the Q&A today.
Everyone.
All right, great. So what's up, Joe? Okay, so Joe and I are going to say goodbye for now. We're going to let Andy and Christina take it away.
Thanks, Lisa.
Thanks, Lisa. All right, everyone, welcome, and thank you for joining us today. So before we get started, we're actually going to give a quick poll because we want to get an idea of who's watching, what our audience is looking like. So just popped up on your screen, there are 3 questions. Are you a beginner or an experienced runner? Are you typically or currently experiencing any aches or pains, injuries? And have you been running indoors or outdoors? We want to get an idea of what people have been doing during this quarantine time. So go ahead and answer there. Great, and let's see the results. Okay, so it's looking like we have a few more experienced runners than beginners. We have definitely a lot of patients experiencing some injuries, some aches and pains, and most people have been running outdoors. Beautiful. So now that we have kind of an idea of what everyone's looking like, don't worry, no matter what you answer to any of those questions, we're going to be addressing aspects throughout the entire PowerPoint. So let's get going. I'm gonna toss it over to my partner, Andy, and he's gonna take you through a dynamic warm-up. So everyone go ahead, stand on up and get ready to move.
All right, thanks, Christina. So we're gonna go over a lot of exercises like Lisa talked about. And just like running, you may wanna make sure that you're warmed up thoroughly. Dynamic stretches, the things that we're gonna do in a second, won't necessarily decrease injury rate, but they will improve performance when done correctly. Dynamic stretches prime muscles for movement. So let's feel what that's like. So me and Christina are gonna stand on up. Hopefully find some open space in all of our very small apartments. But the first one are scoops, something for your hamstring. So let's say I want to do my left leg. I'll take a step forward with my left. I want my ankle pointed up towards me. I'm going to reach down with both hands, scoop up, and I should feel a mild to moderate stretch in my calf and hamstrings. I'm going to take a step forward with my right leg. Ankle up towards me, stomach tight, reaching down, scooping up. Let's go one more time down. Since there's a lot of room. Okay, reaching down, scooping up. Reaching down, scooping up. And then, like I said, just mild to moderate stretching. The next one to kind of progress that are toy soldier kicks. Christina likes to call them Frankensteins.
I think they look like Frankenstein.
So you're gonna kick with your leg, try to reach the opposite shoulder. What you wanna make sure is that your back does not bend. You're trying to keep yourself upright like that toy soldier, like that Frankenstein.
Looking good, everyone.
Okay, the next one's for our hip flexors. So you can start in this curtsy lunge, which just means that I'm in the split squat. And now I'm gonna reach over, so if my right leg's back, I'm just gonna reach over with that right arm, feel a nice comfortable stretch in my hip flexor in the front of my hip, and then back down. And then overhead, kind of giving your stomach a little squeeze, making sure your back's not arching, and just feeling that mild to moderate stretch in the front of your hip. So left leg's back now, reaching over with that left arm, mild to moderate stretch in my hip flexors. And then to progress that, we can go into a full lunge. So if you get my profile here, you should see that my knee's in line with my ankle, and if my left leg's back, me and Christina's left leg is back, then we're reaching over with that left arm. And same thing, stomach tight, you don't want to arch your back, you should feel mild to moderate stretch in that left leg. And then we'll step forward and do the other one.
I already feel like I'm working out, guys.
Yeah, I'm getting a lot of breath, but that's like a good warm-up. Okay, so the last one is everyone's favorite. They're called inchworms, ways to stretch more of your calf.
Get ready, these are tough.
So I'm gonna start in this pike position, and like we talked about earlier, keeping your back straight, you don't wanna bend. And I'm gonna walk my hands forward into a plank position, trying to engage my core. And I really wanna drive my heels down, walk my feet up, and when I don't feel like I can straighten my knees anymore, like they're gonna bend, then I walk my hands forward into that plank, squeezing my stomach. Last time down, I'm gonna walk my hands forward. And I'm really trying to drive those heels down. And then when my knees feel like they're gonna bend, then I walk into that plank. Squeeze your stomach. Whew. Okay, hopefully everyone's sweating a little bit. I know it's hot up.
Great.
And then we're gonna kick it over to Christina. She's gonna talk about some hip injuries.
So now that we feel all warmed up, let's go ahead and talk about what's going on at the hip joint when we run. Now, as a runner, it's important to understand that the most important joint is your hip joint. When you're running, that's what gives us foundational strength, stability, power, and mobility. So we have to know that impairments that are happening at the top of the chain at your hip can then cause compensations and injuries throughout the rest of the lower extremity. So we're going to see a couple of common conditions. They often refer and come from overuse, causing inflammation to the tendons and other soft tissue at the hip joint. And that's when we can see injuries common like hip flexor tendinitis, glute medius tendinitis, and trochanteric bursitis. Two muscle groups are performing a high amount of work when you're running. Those are the hip flexors, which are mainly at the front of your hip, as well as the hip abductors, which are at the back and side of your hip. That's what the glute medius is. So when you're running and you're performing this very repetitive cyclical motion, you're constantly using that hip flexor. You're bringing your knees towards your chest. And there's never really a time when you're fully lengthening that muscle appropriately for recovery. So this is going to build up a lot of tension and cause some pain and discomfort at the front of your hip. Additionally, you might be having weakness to the abductor muscles, which are the ones that kick your leg out to the side. And that's what's really important for maintaining a stable pelvis. So just like you see the girl in the image on the left, we can lead to having lateral hip pain, inflammation, and tightness around those areas that can cause multifactorial injuries. So if you look at this girl on the left, you'll see that any type of impairment on the top of the chain can then lead to kind of like a running form that we don't necessarily like to see because it's telling us that things are going wrong. So now that you understand a little bit about what can be happening at the hip, I'm going to have Andy pop back into his box, and we're going to go over a couple of exercises that can help you prevent some of those impairments. Okay, Andy, so the first thing I need you to do is lie on the couch. How does that sound for an exercise? So everyone, please join us, and I want you to all practice these exercises so you can see what they feel like. Oh no, I think we lost Andy. So you know what? I'm gonna go ahead and demonstrate some things for you while he pops back in. The first exercise is going to be focused on the hip flexor. So what you wanna do is lie on the couch, one leg is hanging off, and then one knee is up on top. And so what I'm doing is making sure my back is completely flat. I'm engaging my core so I don't have an arch in my back. And then I'm actively using my hip flexor to pull my leg up and cycle through, okay? So this is teaching me how to engage my hip flexor while I'm stabilizing my core. Go ahead and go through that about 2 or 3 times and see how you feel. We want this to directly transfer when you're running, bringing your knee towards your chest with a stable pelvis. The next exercise I'm going to demonstrate is called a hip hike. So I'm going to come over to a step over here. You can do this exercise with or without a step. It's a little helpful for visual cue with a step. So if you have a step available, go ahead and pop on up. All I need to do is use the leg that I'm standing on. I'm going to be squeezing that glute, those hip abductors, and I'm pulling my opposite hip up in the air, okay? So what I don't want to do is actively contract my oblique on the right side. I want to actually squeeze my left hip, bring the right hip up in the air, and as soon as you go through a couple of rotations there, you should feel burning in that left glute, okay? And this also is going to transfer to our single limb stability. Again, if you have any questions.
Christina, real quick, can you show us again where the hip flexor is so everyone is clear? Because there was a question on that.
So we have multiple hip flexors. One starts from our back and loops all the way forward and attaches to the front of your hip. But then we have a couple of other hip flexors that if you feel your hip bone, they're attached right in this general area. We can almost look at a triangle here. So we have the top, almost the top portion of your quad, and then muscles coming down from the side. Hope that helps. And then, Andy, you're back. Beautiful. I'm gonna let you catch your audio. And guess what? You made it just in time for the hardest exercise. I need you up on the wall, buddy.
Which one am I doing?
The stork.
Okay, yeah. I know this one.
And I ask Andy all the time, why is this called a stork?
Something to do with you looking like a stork.
Yeah, that makes sense. Okay, beautiful. So the last exercise that's going to be strengthening your hip abductor, like we said, is the stork. So you can go ahead, find any wall space. Andy's going to stand up on his right leg, and his left knee is going to be driving into the wall. So as he pushes his left knee into the wall, he'll start to feel that right hip burning. I hope you're all practicing so you can tell us yes or no, I'm feeling the same thing. We want his core to be engaged. Again, that right glute squeezing. So this is step one. He can hold this position for 10 seconds and repeat about 10 times, or we can start to progress it. So one progression would be Andy is actively leaning his trunk forward while maintaining his core nice and strong. And as he does that, this adds a level of complexity to making the hip abductors work. So you can go repeat that 2 or 3 times. Hope you're all feeling this as well. And then the last progression would be to perform a single leg squat. So from here, Andy again is gonna maintain that left knee pushing into the wall. Then he's gonna slightly bend his right knee, hip sit back, and comes on up, okay? So even if you just perform 2 or 3 of these, you can already feel those hips really working. And this could be a really effective exercise to transfer into your running form. Awesome, thanks, Andy.
Yeah.
Now we're gonna let him rest again, and we're gonna come on over to the knee injuries, okay? So we're moving down the chain. Now, prior to talking about the knee joint and the injuries that can happen, I want you all to understand that injuries that occur at the knee often are secondary to weakness, tightness, stability issues that are coming from other joints, so the hip and the ankle. And we have to think about the knee as a joint that's not really independent. It doesn't have a mind of its own. So it's listening to what the other joints are telling it to do. So we need to make sure it's stable in the middle of everything else that's going on. Some common injuries include patellofemoral pain. That's the most common runner's knee that most of you have probably experienced or heard of. Patellar chondromalacia, IT band friction syndrome, and then there's chance for meniscal or ligamentous issues. Now, when you're considering knee pain, sometimes the various symptoms are linked under this umbrella term. Usually that we're told is patellofemoral pain. But sometimes the pain is coming from different causes. Most of the time, you're gonna feel the pain in this forward and inner part of your knee, manifesting right about here. And so these weaknesses typically come from malalignment of the patella, weakness of the quad muscles, and increased tightness of the muscles that attach on the outside of your knee, like the IT band and the fascia. We can also see some breakdown of cartilage that will cause patellar discomfort, usually feeling it very deep to the kneecap. And then meniscal and ligamentous injuries, like I said, potential that they can happen, but more often than not, it's coming from a traumatic injury. So now let's review a couple of exercises that will help stabilize and strengthen the knee joint. Andy, come on back to your Brady Bunch square, please.
Thanks, okay. I'll promise not to leave this time.
Good, you left me hanging. Okay, so this is your favorite exercise. I need you back at the wall and we're doing wall squats.
Me and Christina talk about like how this is like JV basketball stuff.
And he left out the part that he said he never made the team.
Yeah, never made the team, proud of it.
So for a wall squat, everyone join in with us. You want to bring your knees out from the wall. You want your knee to be at about 90-degree angle and thighs parallel to the floor. You also want your core again to be engaged, shoulder blades touching the wall, and you don't want an arch in your low back. You want the low back as flat as can be. Now, wall squat, you can sustain this. Say you do 3 sets of 30 seconds, or we can also start progressing this exercise. So what we can do is, well, you could do it on one leg if you're a show off and a superstar like Andy. Or you can get a small ball and throw it between your knees. This will start to activate this inner quad muscle. It's called VMO. It has a fancy name. That's usually the muscle that is weak and causes a lot of that anterior medial pain that I was talking about earlier. So you can perform wall sit with this sustained squeeze. Awesome. Thank you, Andy. Hope y'all are feeling the burn in your quads. And then we're going to go to one stretch that will help loosen up both the hip and the knee. So if you can lie on down for me, Andy. Beautiful. And what you're going to do is grab a TheraBand, a stretch out strap, a dog leash, anything you might have. You're going to loop it on your foot and you're going to pull up with your hands. So we want that left knee to be as straight as possible and the right leg to be flat on the floor. You should feel a pull to the back of your hamstring. Once you hold on to this for 30 seconds, you can drop that left foot over across your body. And here you should start feeling more of a lateral pull. So on the lateral aspect of your hamstrings, the glutes, and even the IT band. And then lastly, you're gonna bring your leg all the way out to the outside. Again, knee as straight as possible. And you should feel a pull to that inner adductor muscle. So these are just common stretches that are good to do after your run. And make sure that we're loosening up all the muscles that we just activated. Awesome. Great, now that we looked at the hip and the knee, I'm gonna pass it over to Andy and he's gonna talk about the rest of the lower extremity.
Thanks, Christina. So we're gonna talk a little bit of some lower leg injuries that may occur from repetitive training errors or muscle imbalances that we previously reflected on. There's shin splints or medial tibialis stress syndrome. There's stress fractures which occur at different sites in the leg, like the tibia, the shin bone, or the calcaneus. It can even happen in the metatarsals, which are the long bones in your foot. Some runners may develop a tendonitis, like Achilles strain, but could also develop tendonitis of the outside of their ankle, called their fibulari or peroneal tendonitis. There's also tibialis posterior tendonitis, which occurs at the inside of your ankle. These problems usually occur to weakness and tightness. So let's look at some ways to strengthen a stretch. So Christina's gonna come on back. She's gonna be our demo this time because I'm very out of breath. And the first one we're gonna just do is we're gonna call them heel raises. So you wanna lift your heel off the floor. What you wanna make sure is that your feet are hip width distance apart and you're going up and down as far as you can, no pain. A great way to progress this is heading to the stairs right next to Christina. And we're gonna go into a deficit, which means that we're gonna go lower than the floor. Our sarcomeres are those individual muscle units, and they add in series when you go through a longer range of motion. This is super important as you run because your calf is a big part of how you load and unload your foot. And you can see that her heels come neutral, which means that they're parallel with the floor, not going in, not going out, and she's just going through a range of motion that's just not painful. And hopefully you do enough that makes you tired. The next, yeah, that's enough. So the next one, she's gonna grab a ball and she's gonna put it between her heels. This one works on posterior or tibialis posterior, the muscle that usually gets injured from that side to side motion. So like if you're thinking you're trying to avoid people running in Central Park, you really want to work on this muscle. It'll help you avoid people. So what she's going to do is she's going to have the ball between her heels, and now she's going to pinch up and then lift up towards the ceiling. And then not only should work her calf behind her leg, but also she should feel it on the inside of her ankle. Yep, right there. Now she's going to head to the wall, and now she's going to do the wall sits. Time for her to suffer a little bit, but she's going to do them in a different way. We're gonna do these heel raises, but now sitting on the wall with her knees bent. So you wanna get to like 90 degrees. Same thing like we talked about, core engaged, knee at somewhere between 90 to 60 degrees bent. And now she's gonna perform those same heel raises, but now in the ankle. And now so you feel like a little bit deeper in her calf.
Definitely.
Yeah. So once everyone feels like their calf is nice and warmed up, we're going to talk a little bit about some foot and ankle injuries. So Christina's going to go away. We're going to pull up this slide again. So let's look at some common injuries that happen a little bit lower in the leg, closer to the ankle and the foot. First, there's plantar fasciitis. I saw some people that were already commenting on plantar fasciitis. That's usually an irritation underneath the heel. Another problem are ankle injuries, dealing with like sprains, so ligaments that are on the outside or inside of your ankle. The last one, common injury, is hallux rigidus, which is stiffness and or pain in the big toe. Because you should notice that a lot of these symptoms can kind of play with each other, you want to make sure that you go to physician and make sure to get a real diagnosis if you feel any of these symptoms, because they can really mimic each other. Since we just looked at some strengthening, I think let's look at some stretching that can be really helpful for running. So Christina's going to come on back, and she's actually going to help me with something that we do a lot in the clinic. I know a lot of people have seen Phelps, but we use it too. So it's called cupping or myofascial decompression. It's for people who really feel like they stretch and stretch and stretch, but never really get that full stretch. So we're going to add cupping to what everyone is going to do at home. So Christina's going to help me put it on.
All right.
I'm going to just lotion myself real quick.
This is my cup. I'm prepared.
Okay, great.
And here's a little more to the right. A little more to the right. There we go.
Oh, I see. Nope. Now.
So we have the cup, pump it on, take the suction out.
Okay, that's too much.
Okay, sorry. I'll loosen it up.
Okay, so then she just threw one on me. And now like we do because PT is so active, we never really just want to leave them on people and do nothing. We're gonna stretch and Christina's gonna do it with me. Maybe hers are gonna be a little less painful than mine. So the first one's a runner stretch, very apropos. So the cuff's on my left leg. I'm gonna bring my left leg back. My foot is gonna be pointed towards the wall and making sure that my foot isn't out or in and my knees straight, hips forward. And then I should feel a stretch in my calf, maybe even where the cup is. And just feeling like a nice, comfortable stretch. The next one is for your soleus. So I'm gonna bend my knee a little bit. Still get that leaning forward, but same thing, mild to moderate stretch. You should just feel a little bit lower down, maybe a little bit deeper. Okay, the next one is for tibialis posterior. We talked a little bit about that before. It's the one that we use when we were doing the heel raises, getting our heels to come up and in. So now I'm gonna put the towel on the outside of my foot. And now it's gonna make our foot pronate or flatten. We're gonna go into that same runner stretch, left leg back, gonna pronate that foot a little bit. And now we should not only feel the stretch in our calves, but also maybe on the inside of your foot.
This is your front view here.
Yes, so I have like a side view and Christina's got a front view. And if you have any questions, let's leave them for the Q&A at the end. And then I'll take this cup off and you can see what it's like. Not so bad. I've seen worse. I'm sure Christina's seen worse.
Okay, hope everyone's feeling stretched out and has liked the exercises so far. So the next thing we're gonna do is talk about the elements of a run. So Andy's gonna go ahead and start taking you guys through a couple of specifics.
Okay, so we wanna say that if you're an existing patient, then ask your therapist about these different elements of running. But if you're a prospective new patient, then checking our website for clinics who have therapists with running experience to help you track these components of running. We can help you individualize cross-training and manual correction rehab. So Christina's gonna come on back and she's gonna show us what a good and bad runner might look like. Okay, so the first one is vertical displacement. It's how high your waist or head moves up and down. Christina's gonna show us someone who has a lot of vertical displacement. And then you can probably see that like you're shaking at home. These are like the people that you run on a treadmill and it's so loud. And then she's gonna show you someone who has a low vertical displacement. Her head and her center of mass don't really move a lot. And now she's more of like that gazelle. The second is step length, which is how far your foot travels in front or underneath you. So Christina's gonna show us someone who has a long step length. if you see that when her foot lands, there's a ground reaction force. That's the force that the floor puts into her foot. And when she takes that big step, now the floor is pushing her in the opposite direction she's moving. But now let's say she takes a smaller step length. Now that same floor reaction is going to push you forward. Another element is your cadence. So imagine like a metronome in time with your steps. That would be your step rate. So yeah, so she's going to clap. You can listen to music, and sometimes that really like sets your tone. And the last one is foot strike. So some people land on their heel, or that's a rear foot strike. Christina will show that one. The next one is a midfoot strike. So you're not landing on your heel and you're not landing on the ball of your foot, kind of like right in the middle. If you land on your toes, that's called a forefoot strike. And now she's really landing on the ball of her foot. We asked that question about a new runner versus experienced runners, because new runners may experience increased frequency of injuries as opposed to experienced runners. Experienced runners have a lot of neuromuscular control or a strong connection between their body movements and the wiring within the brain. Whichever style of running you may have, you really want to strengthen that mind-body connection, that neuromuscular strength. You really want to do that by sticking to what is working for you rather than making a lot of these changes. Lastly, Christina is going to talk about what a run should look like, not only your legs, but everything above your waist too.
So before we get into some injury prevention techniques, and once you guys have learned now about foot strike, Andy's actually going to go over a couple of different foot exercises that can help your foot strike. And we're going to have some cute techniques for you in terms of how to strengthen not only the outer muscles of the legs, but also the inner muscles of the foot. So let's go ahead and go over some of those fun exercises we got. It's called toe yoga.
Yeah, so me and Christina have a lot of debate over who's the best one. I always think me, but maybe everyone else can decide while we go through them. So the first one in toe yoga is lifting up your big toe. And you really want to make sure you're not gripping with the rest of your toes. You're just trying to lift up and then back down. Okay, now I'm going to leave the rest of my toes down, lift the rest of my toes and leave my big toe down. And now I really want to make sure with that big toe, I'm not gripping there either. So lifting all your toes except for your big toe. Hopefully everyone feels how challenging this is. This is ways to strengthen the intrinsic foot muscles, the muscles that really load you when you take that first step. Okay, now I'm going to lift all my toes up, big toe down, middle toes down, pinky toe down. All my toes up, pinky toe down, middle toe, big toe. I hear Christina struggling already. I think I won. But now we're going to go to a side view. It's the last one of the exercises. So now you imagine there's a string there and you want to lift up towards the ceiling. You really want to relax your toes here. So now I'm just going to lift up towards the ceiling. And I should feel some kind of contraction underneath my foot. And then just hold it for like 5 to 6 seconds. Okay, so now that we've gone through it once, like I said, everyone at home is going to decide. So there should be a poll coming up. You'll decide who has done it better. And we'll just go through. Big toe up, all your toes down, try to relax them. And down. Okay, now all your toes up except for your big toe, making sure not to grip with that big toe, and then down. Okay, now all your toes up, big toe, middle toes, pinky toe. All your toes up, pinky toe, middle toes, big toe. Okay, side view, doming. So you're gonna reach the middle of your foot up towards the ceiling. And trying to relax your toes. You don't wanna grip like a towel scrunch exercise. You really just wanna work on that dome part of your ankle. And then down. Okay, so now this is a super important part. Let's see who won.
Come on, guys. You gotta come in clutch. I should
Are we
get
done voting?
my
Oh
two-
yeah, I knew it.
Andy, good job.
Thanks.
I've been practicing.
I think I biased people when I said that I knew I was gonna win.
Okay, great. So now that everyone has understood a couple of treatment techniques all the way from the hip down to your toes, we didn't leave anything out. We're just gonna go over some last minute injury. We're gonna go over some last minute techniques on form, and then we'll talk about a few things for injury prevention. So Andy's gonna demonstrate what typical form should look like. So as we're running, we're gonna start at the top. We want our head and neck to be relaxed, okay? We want our jaw to be relaxed. If Andy had a clenched jaw and a really tight neck, you might see his chin protruding out and actually hunched shoulders as well. So by him relaxing his jaw, relaxing his neck, he pulls everything in upright. Now, his trunk. We want it to be a nice, neutral, relaxed position. If Andy's leaning too far forward, it might be telling us that our glutes are not strong enough, and it's gonna make our hip flexors contract even more. And if he's leaning too far backwards, it might be telling us that our core is too weak and it's not strong enough to bring our body forward and stabilize us in the center. So that being said, we would work on all of those aspects in order to create a nice neutral trunk. The next thing are the arms. So we want Andy to have a nice about 90 degrees bend in his elbow. We want his hands to swing back towards past his pockets, okay? And we want the hands to be not totally gripped into a fist, but nice and relaxed like you're holding a water bottle or a couple of pens in your hand. And then you also want, like I said, your core and your glutes to be engaged. Okay, that will help us use all of the muscles that we need to use when we're running more efficiently. Lastly, we want to make sure when his knee comes up in the air, it's a nice comfortable knee raise. We don't want him kicking his butt too much where it looks like his knees are never coming up in the air. But we want knee coming up in order to allow that foot to come forward in front of us. And again, these are just general techniques of what good form should be in order to save energy and not waste a lot of energy trying to hold up your arms or do other things while you're running. So again, running form can be individualized. And if you did want to perhaps change your form according to some of the elements that Andy talked about before in terms of biomechanics, it's always good to consult with a PT before you make any direct changes. And the last thing we're gonna do is just talk about a couple of injury prevention techniques. And these will all be listed out on a handout for you. So don't worry that it's just a lot of talking in words right now. It will be written somewhere for you. Number one is you want to control your mileage increase. So a good handful of you are new runners since quarantine. A lot of you are experienced runners. We have this general rule of thumb that we don't want to increase mileage more than about 10% a week, especially if you are a new runner. But that being said, it's not always very specific. If you're running 15 to 20 miles a week and you increase 2 miles the following week, that's not that bad. Biggest importance is that you are doing something and listening to your body rather than doing too much, even if you feel injury-free. The next tip is to make sure that you're varying your terrain. So before we asked if you're running indoors or outdoors, most of you are outdoor. Make sure that you're varying it between not just the concrete, but also try to find a dirt path if available to you. And especially try to trickle in. If you are a treadmill runner, try to trickle in that outdoor running. You don't always want to be pounding the same type of ground. Next, you want to keep up-to-date sneakers. So again, we have another general rule of thumb. And good, we'll be able to see Andy's sneaker too.
Yeah.
General rule of thumb, 350 miles per sneaker. But I don't want you all to go crazy with that. No one's sitting here counting out how many miles they've used unless you really are an elite runner or training for a lot of races. Biggest importance is that you want to look at wear patterns on the shoe. So if you look at Andy, you could see, we could say he's a heel striker there and laterally. So he kind of hits on his heel and then more towards the outside of his shoe. We could say that that's looking a little flat, but if you look at the rest of his shoe, the treads there are actually pretty intact. They don't look flat enough that we would want to get a new shoe. So if you see that those treads are completely flat, it's your cue. Let's look at something new. And lastly, you want to make sure that you're spending time on your recovery. So today we went over a lot of exercises, which are good to do before you go out for a run and warm up, but you also want to take time on the stretches that we demonstrated. After a run, even if you dedicate 5 to 10 minutes of stretching, it's just as important to let the muscles recover before you go out the next day for another run. And what you need to do is when you mix resistance training and recovery, as we showed you today, you'll improve your neuromuscular control and overall benefit your running. So I know that was a lot of information. We threw a lot of that out there, a lot of exercises. There will be availability for a handout with the exercises for you all to follow along. But right now, what we're going to do is open it back up for a Q&A, and Lisa's going to come back in. She's going to filter some of the exercise, some of the questions that you all asked. So go for it.
Thank you guys so much. That was really, really informative. I've been a runner my whole life, so I got some really good, valuable stuff out of that. Thank you. Okay, so I do want to say before we get started into some of the questions, I did see some people asking about exercises, and Christina did just mention that. We will send a follow-up email to everybody who RSVP'd that includes a PDF of the exercises. You'll be able to get that information. One of the questions that came up, guys, was how do we prevent shin splints and plantar fasciitis?
Yeah, I mean, like we talked about, usually plantar fasciitis, shin splints, those are things that are due to tightness at the ankle. So if you're, and let's talk about maybe plantar fasciitis first. So plantar fasciitis is affecting underneath your foot. People are generally hypermobile at their foot, and their ankle, their calf doesn't move with them. So now your plantar fascia has to move too much. So if you want to think about ways to maybe decrease like plantar fascia pain, probably stretching your calf, getting your ankle to move better so that the underneath of your foot doesn't have to move so much.
Awesome. Thank you so much. Somebody asked about the toe yoga. Should they do that standing or sitting?
You can probably do it standing because that would mimic running the most. All the exercises are ways to cross train. So we want to get you better at running, more efficient. And I think doing it standing might help you with that neuromuscular control like we talked about.
Awesome. Can you differentiate for us? I think this is a really great question because you guys gave us a ton of valuable information. What do you suggest we do before our run? And then what do you suggest we do after our run? And how do we decide which exercises to do when?
Sure. So this, I'll say that it depends. I'll give an answer and then Andy, definitely jump in with whatever you think. The way I like to tell my patients is you want to be doing something active before you go out for the run. This way we know that we're targeting the appropriate muscles to then work when you are running. And then you want to be doing something static for a more recovery basis afterwards. So if we had to give you an example, of course, whatever we did during our dynamic warm-up earlier is something you would want to do before the run. Or say you want to do a couple of wall sits because we're activating that quad muscle. Or you want to do a couple of the hip hikes that we talked about to really make sure that the glute med is activating when you're then standing on one leg. Anything where you're actively using a muscle is going to prepare it for a run versus the 3 hamstring stretches that we talked about. You would want to do that afterwards so then you could lengthen and cool down the muscles. Hope that makes sense.
Andy, do you have anything to add?
Yeah, I think we're definitely on the same page there. That's why we try to set up the webinar in a certain way, really trying to do those dynamic things to prime those muscles for movement, and then kind of like a cool down at the end, something to tell your body that, you know, the effort's done.
Cool, that's awesome. Thank you guys. Let's jump into, one of the questions was, how do I know if I'm overdoing my run? How do I know if it's too much?
Yeah, there's some cases where people overtrain. I think one of the easiest things to think about is that if you go for a very long run and then maybe the next day, it's really hard for you to get back to where you were the day before, or maybe you get to the same mileage, but it's a lot tougher than the day before. I think that thinking about how your run has been set up over the past week or months, and then really try to like listen to your body, and that's like the most important thing. I always think that people know their bodies better than anyone else. So really just like listening to how you're feeling.
I completely agree with that, Andy. And another little tidbit I would give as recommendation is if you are someone who just started running and you're in the position where you cannot gauge, you really don't know like if your body feels recovered or if it feels rested, don't be afraid to take a day or two in between your runs to really let the body reset and then attempt again, especially if you're really at a beginning phase of even just a training program. So definitely listen in the sense where you don't want to do so much and say, I hope I don't get injured. Let's take a step back and make sure you don't get injured.
Awesome. That's great. I guess on maybe a similar note, somebody asked about, this was a lot of information provided. There was a lot of different exercises. Is how do you decide what to do? How many sets, how many reps? Is it feasible to do all of these? How are people going to decide which ones to do on their own?
Yeah, I think that like we as physical therapists tailor what we do to each individual patient. You would need an evaluation to test muscle, range of motion, how well you're running. So me and Christina do a thing where we just videotape how you're running. It can be really helpful, show you all those things that maybe you're missing. It'll tell us maybe about how those muscles activate when you strike the ground. And that can be really influential to how we dictate your plan of care.
Absolutely. And I would say if you're struggling with knowing what exactly to do, when we say do 3 sets of this, it doesn't mean do every single exercise. But like Andy said, we want to create something that's specified to you. So it would be helpful if you did come see us and kind of tune into what's missing.
Cool. I guess speaking on like what we do in the clinic versus what people can do at home, somebody asked about the cup. They wanted to know more about like what does that do exactly. So can you speak a little bit on that?
Yeah, so there's a lot of different theories to it. So trigger points, they're points in the muscle where it's always contracted. Muscles are supposed to contract and relax, but those points in the muscle have stayed contracted. You can do things like deep pressure, which is like a massage technique. You can put the cups on. People use like the stim or like the Graston tool. And then so of course the cupping is a great way to deal with those trigger points. And it can kind of add to the stretches that we've already done.
That's awesome. Can you speak to, I know you guys didn't touch upon back pain today and there's a lot to cover. Is there any general advice you'd give to somebody who has back pain when running?
Yeah, absolutely. So if you think about low back pain, one of the main causes, regardless of if you're experiencing it when you run or just in general, is tightness of the entire posterior chain. So what does that mean? Tightness from the low back all the way down, hamstrings, calves, even the plantar fascia that Andy was talking about. So one of the best ways to decrease some of that pain is main step. Number 1 is increase your core strength, right? And 2 is make sure you allow recovery of that entire posterior chain. So that means doing an exercise to stretch out the low back like a child's pose, and then definitely stretching your hamstrings, your glutes, just as we showed you today, your calves, okay? So anything that's gonna touch upon that whole back side should help to essentially rotate the pelvis back where you need it to be when it's running and loosen up some of that tension directed directly at the low back.
Very cool, thank you guys. Okay, so what are your thoughts on foam rolling? You didn't speak too much about it today. Does it help prevent injury? Should people be doing it?
Yeah, it's foam rolling is great. I think we stress a lot of the strengthening and stretching because those are ways to really prevent injuries. I would not necessarily say that foam rolling by itself would do a whole lot, but I think mixed in with a stretching and strengthening program could really help.
Absolutely. And I have a little tidbit that I like to tell my patients about foam rolling. Most people, they hop on the foam roller and they roll really fast back and forth and they're like, okay, I think I'm doing it correctly. But something really important to remember is that you actually want a slow and sustained pressure through the muscles. So I usually tell my patient, find a spot that's bothering you, hang out on it for a couple of seconds, maybe it's 30 seconds, until you start to feel like that intense pressure is releasing a little bit. And if hanging out on it is too much, then you can oscillate back and forth. But again, slowly and gently, you don't want to speed race through it.
Awesome. Let's see. How would you adjust your run if you're having front knee pain? If when you run, you have pain in the front of your knee, how would you suggest somebody, I mean, as best as you can, adjust their run to accommodate for that?
Yeah, it's so hard to do that without seeing someone because there's so many elements. Christina talked about how your knee is really doing whatever your hip and your foot is telling it to do. So we would have to look at someone's ankle and someone's hip to see where the dysfunction is, because it's probably playing out in their knee.
Absolutely, 100%.
There's some questions here about kind of similar, like about rest, and like if you are having pain when you're running, I guess similar to that previous one, right? Like there's a lot of factors that could be going on. Let's say they're experiencing pain when they're running. How long do they rest after? And how do you balance rest and the activity if you want to continue to be running?
So that's a very good question. And most people ask, like, I don't want to be told that I have to stop running just because I have this pain. And what I usually tell people is when you start to get a pain, it's telling you that something's wrong. And we could at least allow our bodies to have, say, for example, if it's a tendonitis issue, at least a 1 to 2 week of cooling down and backing off a little bit and focusing on other things like our hip, knee, and ankle strengthening and stability, as well as the recovery. So it's not bad to give yourself even a couple of days before you just keep pounding out run on top of run, because you'll ultimately benefit in terms of longevity if you give yourself the time up front, and then you're able to build on a stronger foundation.
Awesome. Guys, last question we had come in, I want to ask is like, how do you loosen up the patella if you have osteoarthritis of the knee? And then should your toes be spread or not spread for the heel raises?
Your toes should be kind of neutral and relaxed. You really want your calf to do all of it, not really gripping with your foot. And then I would say for your kneecap, we talked about some foam rolling for your quad. People with really tight quads, that's putting a lot of pressure on your kneecap because the tendon runs over your kneecap and onto your shin bone. So trying to loosen your quad might really help with that kneecap mobility.
Very cool. Thank you guys so much. This is a joy. I learned a ton today. You guys are awesome. We're going to wrap it up today. We hope you guys really enjoyed it. We hope it was valuable and that you learned a few ways to prevent and perhaps manage some of your symptoms that you get while you're running. If we didn't get to your question, we will do our best to reach out to you directly and give you an answer as best as we can. As an orthopedic outpatient physical and occupational therapy practice, we treat an array of conditions from head to toe. Should you feel that you could benefit from any kind of individualized treatment or guidance, please feel free to reach out to us individually and we'll personally coordinate setting you up for an appointment. In addition to traditional therapy sessions for running, as the group had said, we also offer more advanced video running assessments if you want more detailed report about your running mechanics. As a reminder, we're open for in-person visits as well as telehealth sessions. And for telehealth right now, most insurances are waiving patient costs and out-of-pocket expenses. So please feel free to reach out to us today and we'll get you set up immediately. Thank you all very much for spending time with us today. We wish you the best and be well.
Thanks, guys.
Thanks, Lisa. Thanks, everyone.
Be safe, stay well.